Hello everybody, I am Dr. Arup Biswas. I am a retired professor of cardiology and an interventional cardiologist. I have to look into many types of cardiac patients, including those patients who snore during sleeping, particularly at night. The relationship between snoring and cardiac disorder is manifold and it's multi-pronged. It happens in many ways. What happens that the patients suffering from disease known as obstructive sleep apnea or sleep related disordered breathing, there is temporary cessation of breathing at times, intermittently, transiently for a short time while the patient sleeps, and this happens recurrently, leading to oxygen deficit in the body for some time in the patient. That results in the patient awakening in the morning with insufficient sleep, and he feels headache, lethargic, and often falls into sleep while driving, etc. And also he suffers from hypertension, dyslipidemia, obesity, etc. That results in coronary artery disease, heart failure, and aggravation of the symptoms and acceleration of the disease process. And the patient's other symptoms are, other risk factors are being controlled. If this factor is also not taken care of, the patient is not completely well. So the patient has to be taught in sleeping well. He has to reduce his body weight, alter his calories, and also often has to use a device known as CPAP, which is with the help of atmospheric oxygen, which is pushed into the nostrils of the patient under a small amount of positive pressure, so that the palatal resistance and the pharyngeal resistance is overcome, and the patient has got a good supply of atmospheric oxygen throughout night time, and he wakes up early morning refreshed and gradually gets rid of these disease processes or amelioration of the symptoms and signs. Thank you.